Suboxone versus Methadone, comparing two common medications for opioid treatment. Opioid addiction affects millions across the United States, but there is hope. Proven treatment options can help individuals overcome addiction and lead healthier, happier lives. This video compares two common medications used for opioid treatment, Suboxone and Methadone. By the end of this video, you'll better understand the differences and which one might be the best choice for you or your loved one. Suboxone is a combination of buprenorphine and naloxone. Buprenorphine helps reduce withdrawal symptoms and cravings, while naloxone blocks the effects of opioids and prevents medication misuse. It is taken daily as sublingual films placed under the tongue. Methadone, on the other hand, is a full opioid agonist. It relieves withdrawal symptoms and reduces cravings by binding to the same receptors in the brain as other opioids. Methadone is usually administered in liquid form in clinics and taken daily under supervision. Suboxone and Methadone have been proven effective in treating opioid addiction. However, the effectiveness may vary depending on the individual and the severity of the addiction. Numerous studies have shown that individuals who use either Suboxone or Methadone and counseling have a higher chance of staying in treatment and avoiding relapses. Like any medication, they both have potential side effects, such as drowsiness, constipation, sweating, and headache. However, for most people, the benefits of treatment outweigh these risks. It's important to note that Methadone has a higher risk of overdose than Suboxone due to its more potent effect on the brain's opioid receptors. Additionally, Methadone can interact dangerously with other medications, so close monitoring by a healthcare provider is crucial. Methadone treatment requires daily visits to a specialized clinic for supervised dosing. While it provides structure and accountability, scheduling, transportation, and distance issues can be inconvenient or challenging for many individuals. On the other hand, Suboxone is often prescribed by doctors in private practice, offering more flexibility and discretion. It can even be obtained online, allowing patients to receive quality care from the comforts of their homes. Suboxone, thanks to the presence of naloxone, has a ceiling effect on respiratory depression and opioid effects, making it generally safer in terms of overdose risk compared to other medications. Comparatively, Methadone carries a higher risk of respiratory depression and overdose. It's important to closely follow prescribed doses and regularly communicate with a healthcare provider to ensure safety. Suboxone can be started earlier in the opioid withdrawal process when mild to moderate withdrawal symptoms are present, thanks to buprenorphine's properties as an opioid partial agonist. Methadone, on the other hand, is typically initiated in individuals with more severe opioid dependence and substantial withdrawal symptoms due to its full agonist properties. It can effectively alleviate painful withdrawal symptoms and provide stabilization. Tapering off Suboxone is often considered more straightforward due to the longer duration of action of buprenorphine and the discouragement of misuse through naloxone. However, individual experiences may vary. Tapering off Methadone can be more challenging due to its longer half-life and potential for withdrawal symptoms during the tapering process. You should consult a healthcare provider specializing in addiction medicine when choosing a suitable treatment. Your medical history, addiction severity, and personal preferences can help determine the best treatment option. At Fall River Suboxone Doctor, our dedicated professionals will help you find suitable treatment options for your unique situation. Your journey toward recovery is our top priority, and we are here to support you every step of the way. If you or a loved one is struggling with opioid addiction and interested in Suboxone treatment, visit fallriversuboxonedoctor.com today to schedule an appointment and start your journey toward a healthier, happier life.